This is Kofi Time.
Dear friends, the fight against HIV/AIDS is not only a test for our United Nations family, not only a test for the international community, it is a test for our common humanity.
20 years ago, Kofi Annan was awarded, together with the United Nations, the Nobel Peace Prize. Regarded as one of the modern world's icons of diplomacy, what's his legacy today? How can we prepare for tomorrow based on his vision for a better world? Hello, I'm Ahmad Fawzi, and I had the pleasure and privilege of working with Kofi Annan, accompanying him on many missions around the world as one of his spokespersons and communication advisor. Today we will discuss leadership in times of global health crises. 2 years after the coronavirus first appeared, there have been more than 350 million recorded cases of the disease. And while the pandemic has affected virtually all nations in the world, its impact has been most severe in the most marginalized communities. Years ago, as the world was confronted with another disease, HIV/AIDS, Kofi Annan said, and I quote, "It is my aspiration that health finally will be seen not as a blessing to be wished for, but as a human right to be fought for." I am so pleased to welcome to this episode of Kofi Time a distinguished scientist, a microbiologist, a virologist, who was one of the discoverers of the Ebola virus. In other words, an expert on infectious diseases who was until recently the director of the London School of Hygiene and Tropical Medicine, Dr. Peter Piot. Peter, hello, and you are most welcome on Kofi Time.
Hello, Ahmed. Really glad to be with you after all these years.
Thank you. You are always in the news. Back then, Peter, you deciphered the HIV virus's modes of transmission. You subsequently became the founding director of UNAIDS, the UN agency set up in 1995, which has led the global effort to end AIDS as a public health threat. Was it during that period when you first met Kofi Annan?
I first met Kofi Annan before he was Secretary General. He was under Secretary General, peacekeeping operations, and there was some issue with the HIV among peacekeepers in Cambodia. I was then working with the World Health Organization, and so we met, and he asked for my advice on that. So that was the first time we met. It was a brief meeting, and what was already striking to me is that how much he was not only committed, but also concerned about health issues.
And then what happened?
When I was appointed by then Secretary General Boutros Ghali in December 1994, Kofi said, "Congratulations, and then let me tell you a story." An old man took his 2 sons in a boat, and he said, "Sons, row until we no longer see the coast." And when they had reached that point, he said, "Now, sons, listen, I'm going to die. But remember this, the sea is full of sharks. So don't fall into the water. And if you fall into the water, don't bleed." And then he said, "Good luck."
Do you agree that that world is full of sharks?
Well, by nature, I'm an optimist, so I try to find the positive things, but I certainly have also discovered that not everybody has the best intentions. To Kofi, who became my boss, it was, of course, defeating AIDS. Let's not forget, by now, it must have killed like 30, 40 million people. It's not a detail. But also,
and it hasn't gone away. It's still with us.
It's still with us. I mean, every year, about 700,000 people who die from AIDS, and it has gone up, actually, with COVID, because the services have collapsed.
So how did you collaborate with Kofi to bring the issue of AIDS to the attention of the international community?
Gradually, this became more and more eminently political. From a technical issue, I wanted to break out of the world of health, of public health, because I figured out, thanks to the mentoring of Kofi, that as long as we just talk to ourselves and specialists, it's never going to make it as a big issue. And so that's how we really closely work together. I should say it's thanks to Kofi that we brought AIDS to the UN Security Council. It was the first time ever that a non-classic security issue was discussed there. And it was with the then Ambassador Richard Holbrooke, and the US it was in the chair of the Security Council for the month of January 2000. And so the very first meeting of the new millennium, it was about AIDS in peacekeeping and as a security issue. And that was a breakthrough, I think. And that was also against all the rules, but that was showed that it was not only just a health issue, but also a security issue. And then it was also instrumental in what I think another breakthrough was what was still called the Organization of African Unity. He hosted a special session, a special summit on AIDS in Africa, where up to then there was widespread denial of the issue, with a few exceptions. And this is where also Secretary General then played a major role. And I think he gave there what I still believe is a defining moment in the fight against AIDS. He gave a speech and he called for a war chest. He called for his fellow Africans to speak about it, to call out, because what you can't name, you can't deal with. And one president after the other did it, with a few exceptions. It was not only saying we have a big problem, but also this is what we should do. And that war chest then gave rise to something later, the Global Fund to fight AIDS, TB, malaria. It became concrete. That was really important.
And was everything solved then?
One thing that didn't get into there was access to treatment for people living with HIV. The Western countries, the donor countries, and also many African countries were against that. Both Secretary General and I, we fought very hard, but we couldn't get it through. That seems completely absurd. Why a life-saving treatment was not acceptable to many of the countries in the world. They were scared that it was not possible to do it. And like today with vaccines, it's a scarcity. They're not enough. In the case of treatment for HIV, it was the price, it was the cost.
Even with the pandemic, with the coronavirus.
Yeah, but I think that the cost, it is still, I think they're expensive, but the fact is, certainly the first year, there were not enough vaccines. I think that will soon be resolved this year. We are now billions and billions of vaccines are being manufactured. But then it was really cost. We were talking about like $1,400 per person per year, which was beyond reach for most countries, certainly in Africa, where the largest number of people with HIV were who needed this treatment. So we went on a kind of a crusade for convincing manufacturers, the big pharma, to reduce the cost. And so I did a lot of the supportive work, but it's the convening power of the Secretary General that really made a difference.
And exactly what did he do?
He brought together, I remember, in physical meetings. We met in a hotel in Amsterdam with the CEOs of quite a few big companies, and then also the World Economic Forum, working also through the World Trade Organization in terms of exceptions for public health. So it was a concerted action to reduce the price. But even when the price goes down, you still need money. And that's where the creation of the Global Fund was so important.
Peter, it's wonderful to see you looking well and healthy after having recovered yourself from a severe bout of COVID in 2020. You spent time in hospital, in serious condition, and then it took a very long time for you to recover. That experience must have given you a unique perspective on this disease.
That's certainly true. I had never been ill in my whole life, so I was lucky. And it was also the very early days of COVID. I mean, I got infected in March 2020. gave me an experience that up to now I hadn't had, the experience from the virus inside. Of all people, I got the virus inside. I'm from Belgium, my mother tongue is Dutch, and we have a term, it's something like experience expert. We have the theoretical experts, from the outside, but then we have the people who have the experience. And I said also that it's something I should share, because in these days, it was all about figures, flattening the curve, statistics, and never about people. And that is something that I think that I really learned from being part of the AIDS movement. And it's something that also Kofi always was very committed. It's about people. And in AIDS, in HIV, we wouldn't dream to do anything to set up programs without involving people living with HIV, without talking to them, without talking to communities that are affected. It's something that we've not done with COVID. And sometimes you're paying the price. If only, for example, because in some countries, some communities, there are large movements of people who refuse to be vaccinated. And, the solution is not to tell them you must be vaccinated, you're stupid. That's not how it goes. You need to understand. You talk to them, you listen. And then you see different types of reasons, and some are reasonable questions, and some have to do with something else because they hate the government or they want it a natural way. I think it was an exercise also in humility. It was retrospectively a good experience.
The virologist against the virus. You said something very important about Kofi Annan, and that is he was a good listener.
Yes.
He listened to people. And it reminded me sometimes watching him sitting under a tree with farmers in Africa somewhere, listening. As you said, he followed his heart. And I've seen so many occasions where he followed his heart. Are there any lessons from your work and Kofi Annan's work fighting against HIV/AIDS that you think can be used today in the fight against COVID?
Yeah, I think several lessons. So the first one is that act early. And the title of my memoir is No Time to Lose. And when you're dealing with an epidemic, because let's not forget that HIV also came out of the blue in the 1981. If we would have acted in the 80s with more vigor and resolutely and have recognized it, and there was so much stigma around it because it's about sex, although a virus doesn't care about the sexual orientation of a human host, we would have really saved millions of lives. Secondly, another aspect is about people. We brought people affected with HIV around the table. We organized that a person living with HIV addressed the UN General Assembly. People who have never spoken there. Today it's a bit more common, but we were real pioneers, and I can tell you there was a lot of resistance, both within the system and among some member states, to have sometimes quite controversial people addressing the General Assembly. Can you imagine? And I think we need to do that not only because I think it's a matter of justice, give the voice to those without a voice. That's also one of our jobs, and that's something that I've heard Kofi say. But also, I think we'll make our programs and our interventions better. It's access to innovation and to the products. In the case of HIV, of AIDS, it took about 10 years between the announcement and that we can treat HIV, that it's, in other words, no longer a death sentence, and we tend to forget that a bit, but there was 100% mortality. You would die in the most horrible circumstances. And in 1996, at a conference in Vancouver, it was announced we can treat it. It's not a cure, it's treatment. But the price was so too high. And it took about 10 years before 1 million people in Africa had access to it. And so we had to go through a long process. But that was also, we made history in the sense that for the first time, industry accepted to sell new products that are still under patent at a much, much lower price in low-income countries, a price that was less than 10% of what they were asking in high-income countries. But it didn't happen overnight. It was a huge collective effort.
You've spoken about how he rallied governments and countries, the pharmaceutical industry. but also the artistic community. He knew the power of celebrity and brought in people from all walks of artistic endeavor. But if I may ask you, although far too many people still die from HIV/AIDS today, the global number of new infections is decreasing. More have access now to antiretroviral therapy. So would you say that the international community passed that test and has pulled together successfully?
I think collectively we partly passed the test. I wouldn't give us an A+ at all because it took so long. And I can be patient, but when people are dying, you have no right to be patient. You have to be impatient. But in the end, the net result of all these activities, where I would say the UN really played a leadership role, is that millions of lives were saved. There's no exaggeration, but it's not enough. And what I'm worried about now is that there's some complacency. People think it's over. Still 600,000-700,000 people who die every year. But I think it still is an example of what the UN system can do concretely.
And we both recall that when Kofi Annan was dealing with HIV, his heart was in it. His heart was with the people affected by the virus. And he was vocal, as you said, about the need to empower women and girls and protect the rights of sex workers, gay men, transgender people, and those who use drugs. He said, I remember him saying, and I quote, "We will not succeed by putting our head in the sand and pretending that these people do not exist or that they do not need help. How can we make sure today that we leave no one behind in the fight against COVID? And as the mantra goes, no one is safe until everyone is safe."
You know, it really requires courage. When the Secretary General of the United Nations speaks about sex workers and gay men and so on, and help me to bring them on the rostrum of the UN General Assembly, that doesn't bring you many kudos in your political career. I remember one day he was visiting Geneva, and it happened to be on World AIDS Day. So he calls me and he said, "Peter, what are you doing with World AIDS Day? There is a march in Geneva of the local groups of people living with HIV. Okay, sir, where are they coming and when?" I said, "Okay, I'll come to the hotel and we'll go together." I mean, so just this unique combination to be able to deal with the government leaders of this world, but at the same time, we go in a demonstration. We have to remind that whatever position we are in the world, we should make sure we keep that connection with those who are affected. I just immensely admire not only the fact that he has a heart, but also the courage to do that. And some people will say, yeah, it's a waste of time, but no, it's not, because that is what the UN is about.
Thank you very much, Peter. That really hits the nail on the head. And sum up what you said about the lessons you learned. It is to act early. There's no time to lose. Secondly, that it's about people. Our focus has to be on the people, especially those who are most marginalized, who don't have access. And that's the third thing, access. Access to innovation and access to the drugs. And lastly, and this is extremely important, think beyond COVID. Think beyond COVID. Climate change. Everything is intertwined in our world today. I would like to thank you for sharing your wisdom and these stories with us. Thank you very much, Pete, for being on Kofi Time.
Thank you, Matt, and it was a real privilege and pleasure. The fight goes on.
The fight goes on indeed. You've been listening to Kofi Time. Wherever you are, please share the values that Kofi Annan represented that you think are relevant today using #KofiTime. Kofi Time is brought to you by the Kofi Annan Foundation and the United Nations Information Service in Geneva. Produced by Gianluca Alaria. Please join me again for the next episode of Kofi Time.